The PL Show is brought to you by Kel Charcoal, Kel 360, and Kel Kids Toothpaste. Hello and welcome to today's edition of Kel Toothpaste PL Show, made possible by Kel 360, Kel Kids, and Kel Charcoal Toothpaste. And today we get to celebrate another phenomenal lady. This phenomenal lady is a compassionate, should I say, pharmacist. She's a grateful daughter who believes in a lot of miracles. And recently she's hoping to leave a legacy when it comes to medicine and hygiene, medications, a lot in there. She just doesn't do prescriptions, but she inspires hope as well. My guest for today, if I don't hear the drum roll, I'm not going to mention her name. Yes, I can hear the drum roll. So my guest for today is Dr. Nana Efa Attafua. Please, ladies and gentlemen, welcome Dr. Nana Efa Attafua. Welcome. Oh, wow. Beautiful outfit. You look very good. I'm sure you've heard a lot that you're very beautiful.
Quite a bit. It's happened, but thank God.
You're welcome to the Kel Toothpaste PL. I hope you're doing well.
I am.
Please, you're ready for us, right? We want to
Yes.
delve a bit into your life, and thank you for accepting to do this.
Thank you. Thank you for
Please
having me.
take a seat, and then we can get talking right after the break. You're welcome once
Thank
again.
you.
And we'll take a quick break right here on the Kel Toothpaste PL Show. Please do stay with us. You're right.
Anti-cavity, gum protection, brighter teeth, and fresh breath.
I'm on fat missy way.
The patcho bantama.
Matias.
That's a faco.
It's her smile.
The fresh breath.
Me GD say we use Kel 360 toothpaste. Some kind.
Kel 360 toothpaste.
Gaskia, Kel 360 toothpaste. It's a gum protector.
Onim jom kasan. Ile ko saying. Kel 360 did the way. It's cool mint. Gives me fresh breath and your confidence booster.
Hey, you will see so feeling when you know Kel 360 toothpaste.
Happy smile.
Kel 360 toothpaste, anti-cavity, gum protection, brighter teeth, and fresh breath. Kel, happy smile. This advert is FDA approved.
You're welcome back. This is the Kel Toothpaste PL Show, and Dr. Nana Efa Attafua is my guest, and we'll get talking. Welcome once again. Thank you so much for joining us.
Thank you for
So
having
these days,
me.
when you hear doctor, you're wondering, because now the Ghana Medical Association say we should be sure which doctor we are dealing with. So please tell me about you. Your doctor, what is it?
I am a doctor of pharmacy.
Oh.
Yes.
Wow.
Right.
We'll get into that shortly. But please tell me about Dr. Nana Efa Attafua. Growing up for you, how did it look like? What's that be?
Okay. Your father said I'm your dada B, but first I'm not meeting some your dada B. I thought my life I was struggling. So because my parents didn't, they didn't just give things. They made me aware of how privileged my life was and how everything was temporary. Everything was optional. Nobody owes you this life. So, we're always aware, say, if I say school na ekono, ubeti me akosai too, but you do come Morning Star. And I said, kind of do school, can be factory.
Yeah.
So they were always making us aware of the differences and of the struggle that they've been through to give us the life that we had.
Matis Wabo Morning Star, it means that Uko School, Ewa Ghana,
Patron,
Kakra.
yes.
Maybe let's talk about Nana Efa, or life Kakra to Morning Star, all the way to when you decided, say, be doctor, pharmacist.
Well, me mama a pharmacist. Growing up, I grew up in the pharmacy with the vitamin C pills, and counting colors. I was always on the floor learning and picking up and journeying. And I was also the firstborn. My mama handbag or I'm speaking. One Morning Star, me started I'm say almost skipping me couple of classes.
There's not only my dear to do. What thing?
Na into me jump in nursery 1 to class 1, and then me class 2 to class 4. So class 4, that's when I settled, and that's the age, the class that I grew and graduated with. But what ended up happening was, I was always 2 years younger than not the me akwala class. No, I mean, no more sisi me mom. My classmates were very nice people. No more sisi me, but me VA and it's me VA morning, so I graduated and I call every girls because I was na mama call it. It's me call every girls, but getting to the end of Ebrina, and come maybe me be 15, 16, I feel I'm going university. And that's when my father put his foot down. He said, no, she's not. Because I'm coming to tech for pharmacy. By myself, 16. He was not having that, no. So then I ended up going to GIS. It started from 4. And then I did from 4, from 5, lower, upper. But over there, I was in the same class with people born the same year as I was. So it was kind of even.
Stabilize kaka at that point. But at that point, I'm sure that you were so happy at least was stabilizing because from 4, from class 4, right? And now stabilize here because you jump 2 to 4.
Yes.
So we stabilize here. We
see a pen throw. Do you understand?
See, like
not write with pencil anymore.
We are university now, Papa Sidabi. At that point, how did you take that decision?
I was not happy. But also, my father's not one that you say no to. So I was a relatively docile child for my parents when I was growing up. So he said that's where I was going. I said, yes, please. And then I went.
Osmuka, yes, please.
Oh, yes.
So it looks like it's a Ghanaian thing, eh?
Oh, very much
yes,
so.
Please, no,
yes,
please.
No, please.
So then it looks like you were into that, Abi, because it's me can out nasty and I just say, hey.
You have to meet my father. You cannot.
Wow, was he also a pharmacist? Or was he also
he
a pharmacist?
Was not. My father was actually a building engineer. Yes, but he was the managing director of my mom's pharmacy. He supported her a lot in the pharmaceutical company. So yeah.
It tells me that who your parents are and the impact they have in your life also determines the path that you take. Because your mommy a pharmacist.
Yes.
Then, did you always want to be a pharmacist?
That was all I knew to do. And yes, I
didn't want a building engineer. Because your father was.
Being a building engineer was one of the many things that he did. He was a building engineer. He was a managing director of the pharmacy. He was also, he is, I don't know why I say was. He is currently, he's retired though, so I think that's why I say was. Yeah, and he also was, he was in agriculture. He had a couple of plantations growing, a shea butter factory. Wow. We did many, he supplied demands. He was a businessman. Yeah, he was a businessman. So. My mom also, she does pharmacy, but she also has honey that she supplies to different stores. So no one ever does just one thing. We're always doing something else, and they hustle. My parents hustle a lot.
And there you are hustling too. We'll talk about you. But you've been talking about Daddy and Mommy a lot. Maybe it's time for you to tell me a bit about your family, your background, where you come from, how many you are.
I am the first of 3 girls.
Whoa.
First, from Achimoda, that's where my father's from. But we grew up mostly in Accra, schooling in Ghana and in the United States. Been in the States for about 20 years.
Okay, sorry. Half of your life then?
Yes, just about half of my life, yes. And I love being home, so I've come back. Yeah.
What would make you come back to Ghana? Because in Kofoko Mumba.
Oh, yeah, Japan.
Yes.
No, if anything, it's. I wasn't struggling. Oh, America. I was not like in America, DNA, CVV. Nobody's chasing me. I was not at ease. Yeah, but here I came back to the same room that I grew up in, and nothing has changed here. But it's the same. The love that I have for my people brings me back here. I want the home soil. I want the heat, the harmattan,
the rain, the flooding,
yes,
everything.
And most importantly, the watching. Like, it has to be every day.
You can't do it. How long did it take you to become a pharmacist?
It was a 6-year
Okay.
degree program, yes.
Yeah.
Yeah.
As you were speaking, I'm sure there's this young girl also watching you that would want to do this, but is looking at maybe I've heard that it's difficult and everything.
It is difficult.
Maybe.
It is difficult. Pharmacy is difficult. It will test you. It will test you.
But how did you do it?
You pray.
Okay.
The praying, don't stop praying. You pray. You pray. In the beginning, it was relatively easy, but near the end, yes, it got difficult.
Okay.
It got difficult to the point where, for me and my class, we're just saying D for Pharm D. Like, all we need is a D in the exam. We don't even care about A and B anymore. It's okay. So you just give us a D. Let's just pass this exam and move on.
Wow.
But you have to trust you're getting the knowledge that you need. And when you come out, even if you don't have to know immediately. You just have to know where you're going to find the right answer and understand that answer in order to be able to translate it or present it to the patient. That's truly all you need to do to know your job. Because we're in the information age, things are changing all the time. Nobody knows everything.
Yes.
Know where the answer is, understand why the answer is that. And that's that. But pharmacy is difficult. I promise. Yeah, it is.
Maybe more harmful say and one say mudi yedi in your banner. Yedi prescription abana we in drama yankake.
No.
What does it really entail? Then I'm way pa.
So that is only one aspect of pharmacy, the community pharmacy. No doctor no prescription about na ya share prescription. But even then, prescription na abano. The doctor knows medicine. He knows the body. Me, I know drugs. So and you see this a lot. Usually the first month or the first quarter right after the med school graduates abano. Ombetro do maybe a doxycycline 500. Now so wakotro doxycycline maybe a 350.
Okay.
350 anyhow. It's not a thing that exists. He doesn't know that, but when a bar, I'm like, okay, did he mean to write something else? Because there are many different drugs that come as 350, but at 350 milligram strength. Or did he mean to write this antibiotic and give you, or am I giving you 200 plus 150? Does he really mean? So these questions come up, and then maybe I'll maybe someone says, so based on condition now, and I know, so okay, standard treatment in say, then be a Emefa doctor, and I say, oh, mpacho, na I say, why a mistake, and I say, you bet me as a son, my patients, na. All you know is so they are bremina may fail it. Yes, and then phone call. And if you are more insurance, so if I say insurance, so move it here. So moon to how much will it cost you? If it will be too much, can we find you an alternative that is cheaper? Nina, that was still the same. Nina, all that goes on. And Sana me do a 15 tablets in a row.
Okay, yeah. I see. How long have you been practicing?
Since 2009.
2009. Wow.
Yes.
Up to 2024. Do you enjoy it?
I do very much. Yes.
I know you've been doing this from childhood.
Yes, very much.
Well, I saw the light, the spark in your eyes. It takes us to the Seed to Oak segment right here on the Kel Toothpaste PL show. I'm dying to see the young pictures of Dr. Efa Attafua right here on the Kel Toothpaste PL show. It's made possible by Kel Kids, this particular segment. Brushing time is fun time, and because we have strawberry flavor in there for kids 2 to 6 years, and so there's no hassle to brush their teeth again, and it's FDA approved and very affordable. Do stay. You're welcome back. That was the Seed to Oak segment, and it looks like what's a snack akra?
kakra.
Why a big movement, but now Papa and Sana, because your daddy made the right decision.
He did.
Well, but so let's talk about coming back to Ghana, because I'm sure you practiced there a bit before coming.
Yes.
Okay, how was it? How different is it? Because now when you had experience kakra as a baby with the pharmacy here, then you went there and you were back.
Yes.
Let's talk about, maybe you can do a bit of comparison. Yeah.
Well, first thing, Ghana no, the pharmacist is allowed to prescribe. So if you oba me hona kasa wutia we and I say metimi pay drama. America said doctor and tro Emma wa mintimi ma withdraw. Unless it's over the counter and there you can pick and there, but if pay baby from behind the counter, as I said, doctor trauma.
Okay.
That's one thing. And another thing is insurance. I mean, granted, we have insurance will have a crowd, but approach insurance is no dorsal, and then they are typically the final say on injury, because in John Boy Dingwa, America.
Okay.
And usually we are because of a brand Novas, Novas. Insurance no soon to Novas command. Over price and man because hey.
On to me.
Now for generic but a chrome I've noticed that lots of people prefer the brand name medications, no, because I don't feel it's papa. But Abutrain, so because the FDA and Abutrain is quite stringent, you know, they're able to push and insist the generic medication is just as good as the brand. So.
Okay.
And insurance companies be brilliant to for brand medicine because it's just as good. It doesn't cost them that much.
I think it's a good time to do that education, because most of us, at least from here, Ghana, what I know, most of us are into self-medication. Doctor Bianca French, me coffee kakra 3 days, me say or some antibiotics. Me do a being some shade and one antibiotics. So let's talk about the dangers associated with that.
Just going back a little bit, when you fill your prescriptions at a pharmacy, now usually we keep a profile on you, so we know the different medications that you're taking. In TISana, Obana, Okase, every I fancy one specialist for what will be a mouth. Yet, me a draw way anyway, and I say, offer way near draw way. A draw way potency in a baby reduce. We do, because that is our job to make sure say a draw now it will not harm you. Again, the doctor doesn't know, because if you've seen a different doctor, you've seen a different specialist, he does not know what your cardiologist wrote for you. What could OBGYN? Baby is at the pharmacy when we see your drug profile. And so
it's also good to always use one pharmacy.
Yes, it's good to use one pharmacy. And then it is advisable to build a relationship with your pharmacist, because
okay.
And in as much as we try to be fair to everyone, pharmacy, this I am your normal pharmacist. Yeah, it's one day and I say your face looks downcast. Oh, baby, how? It might come out.
Okay.
And I say then measure prescription I try mom. I say, oh, my me. I'm saying depression but then we'll learn, we'll be kind. And then because I remember you, not that it's not a conscious thing, but you pay closer attention. That's how you teach with Inkwala in class. For the teacher and the kids in their class, the ones whose parents have come to PTA meetings, show interest in the teacher. And those are the kids that do better, because that's the teacher not doing It's the same in the pharmacy also. It's not a conscious thing that we do because we're supposed to treat everybody fairly, but it tends to happen quite often. We're able to make recommendations if and when we know you, we have a relationship with you. Yes.
Okay. But another problem also, apart from the self-medication, which we know now that we are not supposed to engage in, so we need to maintain a relationship with the pharmacy. Now when we are ready also to take care of us, because some pharmacists, maybe are very nice, but how people baby no. Nobody wants to even look at you. You know that it happens sometimes.
Ghana customer service there is general, sir.
Okay.
Maybe I won't interrupt. No, or should YouTube be now interrupting.
Another issue, like I was telling you, is the issue about the generic. You mentioned it. Yes, so at least your school, infirmary near paracetamol, paracetamol, paracetamol. We tend to say it's a nurse, no nimejuma. Because I don't know, so now if you go to the pharmacy shop and they give you paracetamol, you're like, no, I want a Tylenol, I want something else. What's the difference, really? Why should we always take maybe the generic and not the brands? And are different?
Typically, they are not supposed to be different. In order for a medication to be branded and called a generic of a different medicine, they run tests on it, and it has to work. It has to have the same components as the brand medicine, and it also has to work as well as the brand medicine. Brand medications, discovering medicine is expensive, and it takes a long time. It takes years. From the point where they discover the chemical, how they will formulate it, will it be a pill, will it be a capsule, will it be a cream, how are we going to get it to the site of action now? Because I will not make it a cream, that's for sure, because it will not get into the stomach. And then me a tablet and as a capsule, I'll be for orally. I would think so, okay, no capsule, Menya ne tablet ya chalky me de coat be fa ho sana o meni ani nyina ebe kwa kudu be bia site of action maybe am pese do na sana disintegrate na etimi eja adwuma. All that takes time to formulate. Inti and on yes,
omo a eye omo bie won say ya bomb belt first no omo instead say rubber no me menini na no omo bie no one we hwe gunhwem no no, so it's wrong.
Please don't do that.
Because this nice face and don't do that, Okay. Okay, you have to take it the way it is.
There's any buy now. But so also sana so bisa pharmacist because they don't be one of my team yenesa a man kwala but no pony fan say yebeka so okay say because nsa kwala on muti me nti no but sa capsule no so me yenesa na o ma nketinketi na ewo mu no nipa kono ye dro no wa formulating na sana so ubie kra na still nketinketi na wo mu no wa koti ho.
I see.
Inti so de go e bia o de be ma akla do begu chocolate syrup ma na so de begu honey mu na akla na mini spoon na ni nyina akọ ni yam eno no ye ne kakra bi na on mini spoon ni nyina na ni nyina anko nya fi na de begu nsuo mi so anum ni nyina achese dro no enya ni nyina they formulated that way so that you can, vary the route of administration. But because you wouldn't know as a lay person. Yeah.
I think that the PO show has to have a separate edition just for you to educate us more about medicine and all. In all this, I see that you're very passionate about the medication of women, especially.
Yes, definitely.
What's going on with that? Why?
Because I am a woman.
That's biased.
I will accept that. Yes, I am biased. And also, I can help what I know. And as a woman, the problems that I know and that I'm aware of are women problems. And I feel, especially in Ghana, there is quite a bit of gap, disparity in education and access to women in women's health versus with men. So yes, women. I'm here for women. Yes.
Let's talk about women then. How far have we gone? What exactly are we doing regarding that passion for women and their health?
Very recently, I had a milestone birthday, and as is
milestone day.
40.
Age? What you already 40?
Maybe 40.
Oh, wow.
Yeah, maybe 41 to say.
Oh, okay.
So around that time, no, maybe 40. Now I'm say, once I wear a photo shoot, you know, with the 4th floor. Now we girls trip, wear bamba, you know. Now I was a bit.
But why you need that?
Not me. In my thinking, in my retrospection, I did not feel like I had done enough in my life to celebrate and spend that much money. Also, my mother especially, she kept hounding on accountability. You have to, she's been telling us, so now we say, Nyama na mede ma on e de na ode enti me dwindwin me frɛ madam for baako ono ye as a social worker in Ghana enti me no susu hu. And then she told me about this ne company omokoye donation, pad donation at a school. And ovie ye some bisa e wakra bisa girls na say oh nti you know pads na the amount no the bed. And that girl in the car said oh like she's very grateful na pad no or the bed to her now but only BC ya we use to ain't see on top of BEC exam now ube worry about what 12 subjects or so now basically you still have to worry about pad I'll be used to during that time. And then what happens so between now and BC, what does she do? And then she told me she stays home. But if we have 4 days, 5 days, so we can go to school. Because of course only pad obey used to. So in talking to her, because she kept asking me, so what do you want us to get for you? And I didn't want to get anything. So then she suggested, well, why don't you just give back instead? So then on my 40th, anytime someone called me, happy birthday, blah, blah, no, my taxi omo. Because then I decided that I wanted to get into philanthropy and give back. So instead of Sikananka, girls trip, we put that into our first project, which was the Tom project. They address period poverty in Ghana.
It's a Tom project. So I know that you have a foundation.
I do.
It was also birthed at that 40, the Sante Foundation.
Yes, yes.
Oh, okay. So as part of the burden that the Lord placed on you,
yes.
That was when you birthed.
That was
Sante.
when I decided.
What's the meaning of the Sante then?
The Sante Initiative, Sante, it means health in French.
Okay.
But it is also an eponym of my mother's name. My mother's name is Asantua. So then we made it Sante because I am because she is, honestly. So yes, Sante Initiative.
And the Tom project is on the pad.
Yes.
On the pad.
Yes.
So it means that you do other things. You're looking in the future. Yes. You're hoping to do other things. But let's talk a bit about the Tom project.
So with the Tom project, we call it Tom, T-O-M, for time of the month. Yes, so we use that to address period poverty and lack of menstrual hygiene products in Ghana. We also do some menstrual hygiene education for the girls in high school. So during the May 28th is Menstrual Hygiene Day, and we went and did this at the Eastern region because that's where I'm from. And charity begins at home.
Yes,
I went back home. Yeah, so we gave the girls these bags here. We distributed those.
The whole
bag. They get the whole bag.
Okay.
And then inside the bag, we made these little pouches for them, and in the pouch, they usually would keep a pad. And then menstrual panties as well. So these are reusable. And then also we would put some pain medication in there for them.
For the cramps as well?
Yes, exactly, for the cramps that they might suffer. And then we added some wipes in there too. Yeah. We distributed that to about 1,500 girls.
Wow.
And each girl got a whole 3-month supply of menstrual hygiene products. And the pouch and the bag.
Bag.
It was up there. The bag was full. So that's what we did for the girls last year, and it was and of course we went with a nurse. We also did some education. They were able to ask questions, and during that time in the questioning, there was a question that came up from one of the girls, and the question was, when why is it that when it's about the time of month, her palm feels heavy? And I was thrown by that question because I was like,
Because we are different.
no. And I went with my friends. Some of them are doctors, some are nurses. A lot of us in the medical field went there. So I mean, at that point we were thrown. And then my younger sister, actually, she's the one that came and she said, "Nah, the girl has endometriosis."
What is it, Bacho?
Endometriosis is a condition where the endometrium, lady parts, instead of staying in one place, it grows everywhere. So in her instance, it was here. And it's a very painful condition for the girls. They suffer because the thing that triggers the endometrium to grow in all these different places is estrogen. And the estrogen, it also triggers pelvic inflammation. Into cramps, severe cramps. Girls do a period now you think that they are being special and I say
Sister, up to now, must see your way be but still.
No. And then for some the other most of the time it also leads to infertility. The endometriosis, it's very complex. Nobody knows.
So you were going to give parts. Then you ended up
became aware of another problem. So then when I went back, just talking with my friends who are on my board of the nonprofits, we decided, so okay, we can address endometriosis, because in the same way we were thrown by it, I'm sure a lot of people will be thrown by it as well.
And I'm sure you're getting help for that young girl.
Yes,
right?
And also forming a support group for them so they can discuss and find tips and tricks to deal with endometriosis.
But I see C on there. Is it SI?
SI, yes, as in Sante Initiative. SI,
I thought C as in yes.
Yes, in Spanish, yes.
Okay, I see the bottle by you as well.
Thank you.
So this is a whole pack.
This pack is the whole pack that we give to the girls.
And what do we do with the
bottle? This is the water bottle that we made, that we just launched it this year, and we actually are selling that to raise funds for the nonprofit. Yeah. It's a temperature regulated water bottle. Yes.
How much does it, because I'm sure at this point there are a lot of people who would want to help the Sante Initiative. And
this is going for 150 Ghana cedis.
Okay, and where can one get?
Oh, you can get it online or on our website, on our social media, exactly, yes. So it will be there, and you can text to donate. In Ghana, if you dial *713 *2929 hash, when you dial that, you get the prompt and you can donate in Ghana. And then if you're in the US watching or outside in America, if you text Sante, SANTE, to 53555, you also get a prompt to just make donations to the nonprofit.
So it's a good time to take a look, 360 of Dr. Efa Attafua, on what she does. It takes us to the 360 segment. Is made possible by Kel 360. It gives you that cool, fresh breath all day long. Affordable. The entire family can use it. It's FDA approved. Let's get into Kel 360.
Dr. Nana Efa Attafua is an accomplished doctor of pharmacy. As part of the new breed of pharmacists, Nana Efa yearns to leave a legacy of dedication to the safe and effective use of medications in Ghana. On her 40th birthday, she decided to have an introspection of herself, where she found her calling, birthing the Sante Initiative, a non-profit organization which tackles health disparities among women and girls in Ghana.
When she did tell me about the Sante Initiative, it was one project that I was extremely touched and passionate about, because this is a cause that is very dear to the two of us and to the entire team. There is a lot of need within our community when it comes to women and girls, and she's taken up the Sante Initiative to address a lot of these needs. I am glad to be part of the team. I am glad to be working with you to help you realize and materialize this vision that is so dear to you. And I know that we will be able to do so much more than we envision. All the best.
It looks like that's what happens in Sante Initiative. You're not taking time away from your day job?
No, no.
How are you juggling both?
Well, thankfully, I work with my parents at our pharmacy, which is the Victoria's Pharmacy.
Victoria's?
Yes, please.
They're one North Carnation.
Near
the polyclinic.
Near the polyclinic, yep.
Oh, wow. So you came back home to business,
to help,
home business,
yes,
family
to help.
business.
Yeah, my sisters were all in there. It is a family business, yeah, so we all work there.
I see.
Yes.
Oh, that's surprising.
It doesn't take too much away because also when when it's something that you're passionate about, you don't have to work too hard at it. It comes to you. And then also, for the most part, anytime I've told someone about it, they are eager to help.
Yes.
And see, it makes the work easy. And then they'll connect you to another person. This person does this. And so then it doesn't take time for my 9 to 5 at all. And I enjoy doing it. This is the thing. I truly feel like, you know, like Esther in the Bible. Like this is the time that I was called for, you know. So yes, it doesn't take away at all.
Really nice. And I see that apart from the one that you showed us earlier, which has the whole package, there's the TON project. So when there are other projects, you'll have this
different names. Yes, every project has a different name.
You're hoping to undertake other projects. So time of the month project.
Yes.
And I see other pouches.
Yes.
What happens with
these different colored pouches, they are the same as that pouch in your hand, but the black one is the one that we donate to the girls. These colors here are for sale, and anytime someone buys one, we're able to donate a full pack to a girl in need. Yes.
Okay.
Yeah, and
so how much do I have to give for one pouch?
About 25 Ghana cedis.
25 Ghana.
Yes, please.
Mipacho, Metobi.
Thank you.
So that we donate to the cause as well. Very important. So if you're also watching, we have different colors, right? The whole pink one, maybe you can also pick up those ones. So we see different colors. This is nice.
Olive green.
Yes. Okay, so pink and yellow need the Emefa. And then
there's the
chocolate
brown and then vanilla.
Okay, great. So then all these also available on your social media platforms?
On the website, yes, and our social media platforms, yes.
I'll tell you my story growing up when it comes to this. So I'm very passionate about this.
Good.
We didn't have access to pads at the time.
Yes.
But yeah, that's a story for another day that we'll talk about. So this is a project that we really need to support you to make it happen. So that at least more girls around the country, all 16 regions, will have access as well.
Yes.
But I know you're a mother. Or you're a wife as well, and you're a sister, big sister. So let's talk about that part of you as well, and how easy it is putting all together, how you're managing.
Well, thankfully, like I said, I have a good family support system, and we support each other in all our endeavors. So yes, with the children, with being taking care of the home, we were able to fall back on each other, and I'm grateful that I have a very supportive husband who helps me chase my dreams and whatever other cockamamie ideas that pop into my head, and he's a good grounded support. So yes, I'm grateful for that.
Would you sure say why experience it body idea but
Please no.
Okay, I'll tell you. You don't know. You don't know the white tea that you have, the struggle that some of us went through to be able to get here. You put plantain, the leaf in the charcoal, grounded charcoal, and then you brush your teeth. You wait a bit. Yes. Potash. Oh, you see how our grandparents they knew. Then you give us that effect. But now you don't have to go through that. Kale charcoal toothpaste gives you that same effect. You don't need to go through all that trouble to get a happy smile. Kale charcoal toothpaste is affordable, it's FDA approved. Everywhere you go, you can get access to it.
Mommy! Michelle say. Fe. Yum.
Different era, better result. Time has changed and time has brought Kel Chocolate Toothpaste. Healthy gums, anti-cavity, fresher breath, and it whitens teeth. Kel Chocolate Toothpaste. Sankofa.
Yenchi, Kel Chocolate Toothpaste.
Happy smile.
This advert is FDA approved.
You're welcome back. This is the Kel Toothpaste PL show, and Dr. Nana Efa Attafua is my guest right here. Pharmacist Papa Idru training in Abi. So when we were watching the 360, I saw that there were some women were doing yoga or something like that for your health. And then we've talked about the Tom project as well. Are there other projects that we're hoping to focus on as an initiative?
Yes. So the yoga and brunch project that you saw, that was part of our Bloom project.
That's a high-class tea drinking project.
We do it for the mothers.
Very important.
Yes, soft life for the mothers, because girls are bred. So we do. It's the Bloom is a bettering lives of our mothers. That's what Bloom stands for, and so we do the yoga and brunch and other events. You know, there'll be a Pilates, there'll be a Zumba, candle making, other soft life events, so that the mothers come over. Then you can come with your kids as well when we do that. And you come over, you engage with us.
How can one come?
We usually advertise on social media. Yes, so we have an event coming up that we're still finalizing, working the fine details on, but there'll be one in June as well. Usually, so with that, we have a doctor on site that comes and gives a talk on maternal health issues, like maybe postpartum depression or bleeding during childbirth, and the mothers also get an opportunity to share. And then usually what ends up happening is that it turns into like a networking event, because then we also have other things that we do on the side, so people share and then they help each other. But that's what we do with the Bloom project, to kind of raise awareness on maternal health. And then also we have the CARE project, that is for cancer awareness and resources for empowerment. So with that one, we're raising awareness on the gynecological cancers, which is the cervical cancer, and uterine cancer, the vaginal, the vulval cancer. And with those, I mean, most of them, so cervical cancer is responsible for about 20% of deaths, cancer death of the cancers in women. And yet, although it is preventable with a vaccine, many women are not aware that you can just get the HPV vaccine, and that will help you prevent from getting cervical cancer down the line. And with the CARE project, we just want to raise awareness, give them resources, and tell them there's clinical trial here. There's a little group here that's talking, because cancer is hard to deal with. And then we also try to find care for the caretakers as well, because cancer is one disease where it takes a toll on everybody, not just the person suffering it. But yes, that's what we're doing with the CARE project as well. So those are the 4 different projects that we're working on. And hopefully, at least if nothing else, we would have impacted one woman's life, given her information.
Like the way we did with that young girl in school during the Tom project. And these are a number of projects that will get to definitely support the Sante Initiative. Some young ones watching now, at least, is on that path that you started. Please tell them why you don't need to think that we are privileged in Tiansa, so we be.
No. We are privileged that the onus is on you to actually do something. In the Bible, Leviticus 23:22. Matro said, when you're harvesting now, it's for the foreigners and the underprivileged, so that they can also come and pick up. Even then, Yakupon and said, when you're harvesting, quote unquote, don't gather everything for yourself. Leave some for others. you can't be the one bright shining star. Not everything around you, I assume. But for me, definitely, the other thing that I want to be able to achieve is to help someone that cannot help me back. I don't want a quid pro quo, you do for me, I do for you. I want to be able to help you, and I've left, and you will see my child, my nephew, someone be like, you don't know me, but your mother came and she did A, B, and that is all I want. That is true. That is all I want to hear about myself in this world, and then I'll be happy. But I think if you were given something, you should give back. It's your responsibility. You can't hoard it all for yourself, you know. So yeah, that is truly what I try to achieve with this.
These are great parting words. Nana Efa, bless your heart. Why?
Thank you.
God bless you, and may you continue to be well with you. And as we wrap up, we have a tradition right here on the PL show. We can't let you go. Samara Company Limited, manufacturers of Kale toothpaste range of products. So this is from us to you. We are the Kale kits. We are the Kale charcoal, Kale 360, Sasso insecticide spray, Roma. Nina won't be.
Insecticide spray never work because
Nina won't be at the Bema. I face no we ochini. Meboa. Inti Bema asisiga. Near the ashe when you nyamni who say anytime you see this, tell you that you are the queen that you are, and you ought to be celebrated. So from us to you.
Thank you so much.
You're welcome, darling. Continue to be phenomenal. Sign here out.
Thank you everyone for joining us on the PL show. We hope you have learned something from us, and we look forward to seeing you next time.
And make sure you support the Sante Initiative as well. Another edition will come your way same time from Dr. Efa Attafua and myself. We say goodbye.
Thank you. Bye-bye.